Good evening, all. Myself, Dr. Kiran Varma, working as Head of the Emergency Department, Yashoda Hospital, Malakpet. So, I would like to welcome you all for this series of webinars connected by Emergency Department of Yashoda Group of Hospitals on every Friday. Being an emergency physician, we deal with many things. It includes clinical works and administrative roles and all, and etc. Being emergency physician, sitting in emergency department, our spectrum is very broad. It includes, it covers many of the entities. One of the aspects is like dealing with the medical legal cases. So which is very crucial, very important for us, because it is going to save our skin and our organization. Then it is useful in many of the ways. So we should have thorough knowledge on medical legal aspects and where to apply, then how to apply it, then when not to apply. Then there are many queries regarding the same thing. Sometimes we might be in dilemma whether to do the MLC or not. If we do MLC, whether to inform the police or not. So there are many clinical problems where what we face in our day-to-day practice. So to enlighten on this topic, we have eminent speaker Dr. Saravanavel, who is head of the department, emergency, Thanjavur from the emergency Meenakshi hospitals, Thanjavur. So here I would like to invite Dr. Saravanavel sir from Meenakshi Hospital, Thanjavur, to enlighten on this topic. Dr. Saravanavel sir, please welcome and take over the floor.
Yeah, thank you, Kiran, for a nice introduction. So, shall I share my screen?
Share it now, sir.
Okay. So, is it visible clearly?
Yeah, it is visible, sir.
Yeah.
Please.
So, good evening to all. So, I would like to thank SEMI for giving me the opportunity, as well as Yashoda Hospitals, and Dr. Srinath for is organizing wonderful sessions all over, almost for the past few months, I think. And even I know Dr. Kiran and Dr. Naveen R Nimmala is also doing a wonderful job. So let us go to the topic proper. So I'm focusing on my experience for the past 10 years. So I have attended nearly more than 400 courts in and around Thanjavur district, nearly 4 districts I'm covering. Those are the patients coming to our hospital. So these are the 4 common type of cases we encounter. One is motor vehicle accidents. Commonly, almost 90% of the MLCs constitutes this one. Then assault, then insurance claim, and fourth one, negligence. As we descend down, the complexity increases. So for motor vehicle accidents, when we are going as expert evidence, the documentation is not that much given importance, and we have to just explain the wounds and we have to just come out. In assault, the complexity a little bit more, and the cross-examination will be a little bit tough, and they will be showing the weapon, and they will asking about whether this type of weapon can cause the type of injuries like that. So we should know the mode of injuries as well as how the injury happened, and whether the police or who was showing the weapon will cause that type of injury. We should be having some knowledge about forensic details also. Then third-party claim or MCOP cases. So there mostly it will come to the hospital administration, and sometimes most of the times I'm seeing emergency physicians are taking over as a administrator role also. So they should be knowing about these MCOP cases or insurance claim cases whenever it's coming to the court for compensation. So we have to appear in the court as evidence. And fourth one is negligence. In all the above 3 cases, we will be called as expert evidence. But in the fourth one, in the negligence cases, we will be called in the court as accused. So definitely there will not be any respect at all for our doctors. So even whenever we are going in the court as an expert evidence, we will be given priority. So in the court, the evidence will be given as a list from 1 to 15, 1 to 14, something like that. Even our name is in the 14th evidence, we will be given the priority, and we can go to the box as the first one to deposit the evidence, and you can come back. So court will respect the doctors until the doctor is called as a expert evidence. But if you are called for the court to attend as a negligence criminal cases, then we will be given no respect, and we will be treated as accused. So we'll see the proceedings. First, we will get the summon. The court will be calling the doctor through a summon. So it should not be refused. So you should not panic. Don't afraid it. So as I told you, so whenever you are called as expert evidence, you will be given due respect. So you will accept the summon. And if you have some commitment on the particular day, you can request the police to change the date also. So they will definitely change the date. So in the summon, what things you need notice is only thing is who issued. So which court issued. Sometimes you may get two summons. One summon may be from a district court, another summon from a high court, something like that. So the order of priority should be given the higher court. So you have to go to the high court summon. You have to accept the high court summon, and you can tell the district court to change the date for some other date for you going for delivering the evidence. So to whom it was issued. So most of the times, it really your name will be there. Sometimes it may come into some common name like duty doctor or a casualty medical officer, or sometimes may come to the management chairman or a particular hospital name, like that it will come. So you should know whom the summon was issued and the parties involved. So who are the parties involved, or if it is between the two persons, so one person may be the accused and one person may be a victim, or sometimes it may be between the a particular patient and an insurance company, or sometimes it may be between a hospital and a patient. So you should know who are the parties involved, under what section the cases are being impacted. So sometimes it may be sections 297 IPC mean a simple rash driving. The punishment will not be much. Some 500 rupees punishment will be there if the crime is confirmed. So in that case, the lawyer will not go with some complex questions. But if they are the section is under 304, something like that, even there is a punishment of life imprisonment or even sentence to death. In that case, the complexity will be increasing. So you should know the sections, what are sections mentioned in the summon, and you should know the documents to be produced. All those things will be mentioned in the summon. So here's an example of a summon. Here you can see that there's a MCOP case. That means there's a third party claim insurance cases. So motor claim opinion forms. So in that case, it will be coming to it is between the particular patient and the insurance company. So it is coming to the duty doctor, or sometimes it may come to the hospital administration. So if it comes in a common name, so just to get some authorization form from the hospital. So if you are going instead of like that, if you maybe are regularly going to the court. So sometimes if your name is not in the summon, so you are appearing in the court, the lawyer can be sometimes ill-treating you. So you will be having some benefit, get some money from the patient. That's why you are appearing in the court. So in that case, you can get an authorization letter from the hospital, so that you can show them the authorization letter. So I am representing on behalf of the particular hospital, so that I am empowered to deliver the evidence. Like that you can tell. So whenever there is a common name, definitely you get an authorization letter from the hospital. And mostly it will be in the local language. So they'll be telling the date and time of what time you have to appear in the court, and what are the documents you have to produce. All those things will be there. And finally, in the lowermost side, they know which court has summoned you. So if it is a high court, definitely you have to give priority for that. And if it's a lower court, you can give second priority. And if it is some sessions court, something like that, the punishment they cannot give punishment more than 3 years. So definitely the lawyers will not ask you more questions, and you can be a little bit relaxed. So all these things you should notice before going to the court. So if it is from some district court, something like that, even they can give some life imprisonment. So the questions will be more. So you have to prepare very well before going to the court. So you have to see all the documents on the case sheets before appearing in the box. And these are the documents mostly they will be asking: AR copy, wound certificate, discharge summary, scanned reports, hospital bills, and case sheet. Most of the times we'll be limited to AR copy alone. So very rarely you have to produce all these things. And wound certificate commonly given by the primary consultant who treated the case till discharge. And sometimes, so I used to give the wound certificate in our hospital regularly. So that's why I have given a little bit word about wound certificate also. And sometimes you may be asked the questions about so at what time the patient gets discharged, what is the condition of the patient when a patient was discharged. So those things you need to tell to the court. So these are the documents mostly they will ask you to bring down. So sometimes you need to bring the hospital bills. Whenever it's an MCOP cases, that's a third-party claim insurance cases, you need to submit the hospital bills also. And sometimes it's a negligence cases, you have to produce a case sheets also. So one by one we will see. First we will see about the AR copy. So most of the times this is the most important thing most of our doctors are writing. Emergency physicians and residents are writing. So you should give the complete patient details. So don't omit any column or any space. So to fill all the spaces regarding the patient details. And recently I had a problem. So usually I used to write who accompanied the person or who brought the patient. But in the court, in the lawyer, they particularly asked who is the informant. So I replied that the patient the attender who brought the patient only given the history. But he was asking particularly whether is there any word called informant. So from whom did you got all these details like mode of injury, date and time of injury? So I didn't have any answer for that. So now I changed in my in the register. So I used to write now informant instead of brought by. Okay. So you have to write the proper word you should use in the AR book. So then you have to write the date, time, and mode of injury. So commonly you will be writing. And if possible, you can modify your AR. So sometimes the government may be giving some prescribed format for the AR copy. You can modify. Sometimes the residents may be missing some details. So you can get all those things like it's something like with some mentioned headings like so what's the date. So like a date, some space, time, space. Then mode of injury, some space. So like that you can modify your AR copy. Then date and time of admission. Then mode of injury, especially if it's an assault case. So where the patient was assaulted and how many persons involved, whether the persons are known or unknown, and the weapon used. All those details should be mentioned. Even you can make a separate space for this thing. And regarding the other patient's data, you have to write the patient vitals and his conscious level. And you have to write the description of injuries. So next slide, I will be showing that. Then recently, another code they were asked about the age of the wound, whether it's usually commonly given by the forensic doctors, but they will be asking whether the wound is fresh or is it bleeding from the wound, whether it's also freshly bleeding or active bleeding is there or not. So those things we need to write. And if it's sometimes the patient may be presenting to our hospital some 5 days or 7 days later after treating it, getting treatment from some other hospital. So you need to write that there's a healed wound, healed abrasion, something like that. So you need not give exactly it's 3 days old or 5 days old, but you can write that partially healed abrasion noted or something like that. The fresh bleeding is present on the wound. So something like that you can write. Okay, so it will give more comfort for you whenever the lawyers are asking questions towards us. If you're not mentioning the age of the wound, then they can easily manipulate that. So there was no description of the wound. So actually the wound might have happened some 2 days back. The patient got admitted in your hospital. There's some problem between the particular two parties. So to penalize the parties, particularly there's a patient who was admitted is giving some false complaint like that they can manipulate. So that's why you have to write the wound as a age of the wound that has to correlate with your date and time of injury which happened. Okay. So then comes so these are the common things used, right? So this everyone knows. So here's the patient details, his age and his gender. So then brought by this older thing we used, right? So now we have to write informant and other patient address, something like that. So patient ID marks. Then you have to write the details. So at what time the examination commented and what's the date. So what's the mode of injury, mechanism of injury, everything you have to write. And here is the patient details and put your signature with the date and time. So you have to write whether you informed the police or not, and whether the name of the police station which you have informed also you should write on the AR book, AR paper. So this is a common classification of abrasions. So one by one the wounds we will see. So most of the times they will call in they have to inform the wound as in the local language. So in Tamil we call abrasion as a sirai pukayam. So like that, if you are pertaining to the particular district or state, accordingly you have to represent. In High Court, you can usually commonly use the English words or our medical terminologies. But in local courts, sometimes you should be able to translate into your local language. So abrasion, it is commonly classified into tangential and compression abrasions. So tangential abrasion is caused by the friction or sliding force. Again, it's classified into linear and brush wounds. So linear wounds are caused by some scratches. So sometimes the rape victim will be there, or fight between two individuals can cause some scratches by a sharp object. And sometimes it may be a brush. Some broad based object can cause grazed abrasions. Simply whenever a patient is falling from a two-wheeler, he will get a brush or grazed abrasions. The patient also may be getting a compressed abrasions caused by crushing or pressure abrasions, again classified into patent and non-patent. So patent abrasion is again classified into impact and contact abrasion. We will see one by one. So this is a linear or scratch abrasions. So commonly with the nail marks you can see. So it's a tangential force. It's very superficial, involves mostly the dermis and the epidermis alone. And this is a grazed abrasion or brush abrasion. So commonly caused by a blunt force with a broad base. And this is a patent abrasion. That's a contact abrasion which is caused by pressure or crushed force. So mostly we'll see in the hanging victims. This is a contact abrasion and this is impact abrasion. So caused by a superficial bite marks. And regarding the degree classify abrasions, first, second, and third degree. This is a first degree abrasion, involves only the dermis, usually redness or sometimes epidermis alone getting peeled off. And this is a second degree abrasion, which involves some up to dermis, so skin is a little bit lost, and we call it as a deep abrasion sometimes. So this is deep abrasion, otherwise called as second degree abrasion. And third degree abrasion also called as avulsion. So the complete tissue will be getting torn, and up to subcutaneous plane depth it will be involved. So this is a third degree abrasion, otherwise called avulsion injury. You can see that there's a skin peel. Commonly you can see that scalp avulsion injuries, or sometimes there will be in the plantar aspect of the sole, heel pad avulsion injury also we can see. So it is caused by again tangential force, just peeling the skin off. And this is a healed abrasion, partially healed abrasion, since it's not a completely come out. So scab wound you can describe in the yearbook, otherwise you can call it as a partially healed abrasion. And this one is a healed, and another one is a partially healed abrasion, you can mention that. So if they in the court they are asking, you should be able to tell that it's approximately some 5 to 7 days old wound. So it should correlate with the date and time of injury. And this is a laceration. So laceration is caused by again blunt force. You can see that there's a difference, a simple difference between laceration and incised wound. So you can see in the laceration, the edges are, it is irregular. Okay. So edges are irregular in laceration. In incised wound, the edges will be very clear. So it will be clean cut wound, and it will be having three-dimensional measurements. So one is depth, another one is breadth, another one is length. So you have to mention 2 into 3 into 2 centimeter laceration, and the landmark. So where it is in the forehead and the right side of the forehead, on the left knee, like that you have to mention. So laceration is caused by a blunt force. Abrasion is also caused by a blunt force, mostly the tangential force. Okay. And this is an incised wound. You can see that it's a margin is very clean and clear cut injury is there, and ends with a tail. So in this tail gives the direction of force. So this person is being attacked with a sharp weapon from right to left. So that's why here it's started. Gradually the depth increases, and again the depth comes down, and finally ends with the tail. So from this wound, you can mention that there's an incised wound with clear margins and a tail on the left side or right side. So the patient is being hit by a person with a right-handed individual having a weapon on the right side. So slicing from the left to right. So that's why you are getting a final tail on the right side. So this, if properly you are writing, you have to write like this. So there's a 2 into 1 into 1 centimeter incised wound noted on the left to forearm with the tail mark on the left side or the bottom or in the superior aspect, like that you have to mention. Okay, this is a cut injury, so it's a clean cut injury, again caused by a sharp weapon, and you should not write like this is a laceration. So sometimes residents are commonly writing all these things as a laceration, incised wound as laceration, cut injury as laceration, all the even stab injury as laceration. So don't write laceration for all. So laceration is caused by a blunt force. All the other things, incised wound, cut injury, stab injury, all these things are caused by a sharp weapon. So these things should be correlating with your what the patient attendant is giving history. And the exception is when there's a wound on the scalp, commonly if it's a pediatrics, the laceration is will be mimic like an incised wound because of the So tight attachment of the scalp to the aponeurosis, scalp aponeurosis. So sometimes the laceration, they may be falling on the ground and they'll get a laceration, but it mimics as incised wound. And another one is injury on the scrotum. Sometimes the patient may come with some incised wound on the scrotum. Because of that, there's no support. The scrotal wound will look like some laceration. So incised wound on the scrotum will mimic laceration, and a laceration wound on the scalp will mimic like a cut injury or incised wound. So you have to, whatever injury you are writing, the injury should correlate with your mode of injury or the mechanism of injury or the weapon what is used. So whenever you are going to the box, you can correlate with the weapon what they are showing to you. So this is a chop wound commonly caused by a sharp heavy weapon. So this is simply like a cut injury, but if it's like a heavy weapon, some marval, something like that, then this will be like a deep cut injury, which may be up to the bone depth. So it should be like mentioned as a chop wound instead of a cut injury. So this is a stab wound. You can see that again, it's a clear cut margins, but usually you can see that it is a lancet shape. Okay. And only 2 dimension you can mention in a stab wound, because you cannot measure the depth. So you can write, so 2 centimeter long and 3 centimeter broad with unknown depth. This is a description of a stab wound, which is noted on the patient's left side back, or on the multiple stab wounds noted on the patient's back, or you can mention 4 or 5 stab wounds present on the patient's back. So main thing is stab wound will be always smaller than the weapon which they are showing, because skin is elastic. You will be writing that there will be 1 centimeter long stab wound, but they will be showing a knife with 2 inches or 2.5 inches, because whenever the knife enters the body, the skin will be stretching, it is giving way, and knife will be going penetrating. And whenever the patient is the accused is taking the weapon out, again the skin will recoil and the wound will appear small. So we should know the science back this one. So they will be asking with sorry, I mentioned the wound length is only 1 centimeter, 1.5 centimeter, but the weapon is having some 2 inches thickness. Whether this weapon can cause this type of wound, so you should be able to answer the question also. And other things are penetrating and perforating injury. So penetrating injury is a injury which is on the body cavity. Only one mode of entry you can see, you can notice. So you can see there's a knife on the neck. There's a one point of entry is there. But here you can see there are 2 points of one is entry and another point of exit is there. So whenever there is any hole in the body cavity, you can, if you are able to demonstrate only the one side entry wound, then it's a penetrating injury. If it's you can demonstrate both entry and exit wound, it's a perforating injury. And this sometimes the patient may come to your hospital with a sutured wound. So they might have given some stay sutures, something like that, or they might have given sutures for simple skin lacerations. They will be sending for some systemic injuries like abdominal or head injury. In that case, you have to mention this is a sutured wound. Only 1 dimension is there, so not 3 dimension. So don't write that 2 into 2 into 1 centimeter. So you cannot measure it, and you cannot comment on this wound. If it's whether laceration or incised wound, you cannot comment on that, because they might have depredated the wound after suturing. You cannot comment whether it's a laceration or incision. So you simply write it's a sutured wound, 5 centimeter long suture wound noted on the left side of the forehead, something like that. Okay. And sometimes the patient may come with staples also. So you write simply, so some 7 centimeter long stapled wound noted on the left side of the abdomen, something like that. Okay. So don't mention like it's a laceration or abrasion, or sorry, a laceration or a incised wound. After stapling or after suturing, you cannot comment on the wound. Okay. It's just simply write, you can write a suture wound or stapled wound with some particular single dimension length. So next one is a contusion. So contusion is caused by again a blunt force. So usually the skin is intact, only the underlying subcutaneous plane is getting damaged, and blood will be collected beneath the skin. So you can see some discoloration, and sometimes you may see some hematoma also. So this is a patterned contusion. You can see some finger marks and some assault may be there. So with the bare hands, you can see that you can write that the finger marks not on the left side of the face, something like that. Or sometimes the tires, police may hit the person with some stick. So you can see some tram track appearance on the patient's leg or on the patient's body. So you can write that. So that's a pattern contusion, which is meaning a tram track appearance or a stick mark or a tire mark or with a bare hand mark noted on the patient's particular body parts. So, you can mention like that. Okay. So again, this is a collection of, let's say, hematoma. So definitely there will be swelling will be there. There is a swelling with a discoloration. You can mention it's a hematoma. And you should also mention the other type of hematomas. When the hematoma is smaller in size, less than 4 millimeters, it is called as petechiae. And if it is between 4 to 10 millimeters, it is called as purpura. You can see the comparison. So sometimes the patient may come with both. It's not an RTA patient. So sometimes you can see these things in the patient hanging. So they'll be having multiple purpura and petechia on the face as well as in the conjunctiva. So this is a classical example for differentiating. So dengue patient with some small petechia and a little bit larger purpura. And a large collection more than 1 centimeter is called ecchymosis. So commonly we will be seeing this raccoon eyes, and the base of skull fracture is in the anterocranial fossa. You can see this type of things. So you can write it as a ecchymosis. When the blood collection is more than 1 centimeter, it is ecchymosis. So here is a comparison of these three things. So smaller one is a petechia, medium size one is a purpura, and larger one is a ecchymosis. Okay. And one more thing is a punctured wound. So already I told about the penetrating wound. So penetrating wound commonly happen in the body cavity, and non-body cavity parts like arms or legs, you have to write it as a puncture wound. So don't write a penetrating wound. It's a puncture wound. So commonly caused by the fractured bone and sometimes due to some sticks pricking on the skin. So commonly it's due to the bony fracture segment which is coming out to the skin, which is called a punctured wound. And this is a closed fracture, or otherwise called a simple fracture. So the skin is intact. That's all. It's a simple closed fracture. And this is a compound fracture. When there's a bone fragment is protruding out, so it's not a closed fracture. Open fracture is otherwise called as compound fracture. And this is a comminuted fracture having multiple bony fragments. It's a comminuted fracture, otherwise called as complex fracture. So both are same. Complex fracture as well as comminuted fracture is same, which is having multiple fragments. So simple fracture is a single two fragments. Multiple fragment is there, then we can call it as complex. Sometimes there will be open wounds, something like that. Then we can call it as compound complex fracture or compound and comminuted fracture. So like that we can mention in your AR book. And this is a complicated fracture, that means with a vascular or nervous system injury. So distal nervous injury or presenting with vascular injury, you can write it as a complicated fracture. Okay, with some lacerations also there. So another thing is dislocation or subluxation. So partial dislocation is called subluxation, and complete dislocation is a complete movement of the particular body part from other connecting tissue is a complete dislocation. So I have to mention these two things also. So commonly we will be encountering in shoulder dislocation or in the spine fractures. This is more important. Most of the times we used to miss oral cavity examination, and we'll be writing simply as a multiple dental injury, multiple teeth loss. So you should not write like that. So you have to examine properly the oral cavity, and you have to mention the names. So this is a central incisor. So we have a 32 teeth in adult. So this is a central incisor. Just we can consider this quadrant. Central incisor. This is a lateral incisor. This is canine. First premolar, second premolar, first molar, second molar, and third molar. So totally 8 things are there. And so like this here also there will be there. So 2 central incisor and 2 lateral incisor, 2 canine. And there are 4 premolars and 6 molars. Okay, so from distal to deeper inside the mouth. So here's I can take this particular teeth as an example. If you see there's a partial broken of this particular teeth. So the teeth is the parts are particularly we are prescribing. The medial side is a lingual side. That's why this is a lingual side. So here is the tongue. So medial side is a lingual side, and the outer side is the buccal side. Okay. And this portion, which is distal to our body, inner body cavity, this particular surface is a mesial surface, and this outer surface is called a distal surface. So you should know the parts of the single teeth as well as a teeth hole. You have to know the body, the parts of the teeth. And here is the pictorial representation. So here the numberings are given. So you can put this 4-quadrant picture, and if a particular canine, this one is lost, then you can mention as number 3. That's all in your yearbook or in your case sheet also. So avulsion or partial broken teeth of you can write it as in the upper left quadrant. There is a loss of canine teeth or lateral lenses are like that. You can in detail you can write. Otherwise, just put a 4-quadrant picture and you can mention it as either third teeth or sixth teeth avulsion or seventh teeth partially broken or mesial series broken or lingual series broken, like that you can mention. So this detail is very important. So most of the times we are missing, but sometimes it will be very important whenever you are appearing in the box. Okay. So don't write multiple teeth avulsion, multiple teeth fracture. Don't write like that, but you can write the exact teeth which is injured. And coming to the wound certificate, so we classify into simple and grievous injury. So mostly the simple injuries will be given less punishment, and grievous injury will be even the patient may be given a life imprisonment or even they may sentenced to death. Okay, so it is classified in the section 320 IPC. So these are the 8 classifications. So even it will be in exams commonly will be asking in basic sciences. So one is emasculation, then permanent privation of the eyesight or total vision, then permanent privation of the hearing, then privation of any member or joint. There is it's amputation, something like that. Then destruction or permanent impairing of the powers of any member or joint. If the patient is developing some quadriplegia or hemiplegia, it's a grievous injury. Then permanent disfigurement of the head or face. This is a more important one. So most of the lacerations, it will cause a permanent scar in the face. Okay, so you have to, whenever you are writing the wound certificate, you should be very careful. So whether a particular wound will cause a permanent scar on the face. So how to know? Whenever if it is any aberrations, usually superficial aberrations will never cause any scar. When it is involves epidermis, definitely it will not cause any scar. When there is involvement of dermis, then only we will get a scar. So sometimes you will be shaving regularly in the morning time, you will be saying no, so you will be getting some scratches on your face, but never we get a scar. That means your epidermis alone getting damaged. But the same blade, if you are putting some incision with some 2 or 3 millimeter depth, so lifelong you'll get some white line on your face. So scar will be caused only when there's involvement of a dermis. So whenever depth of wound is more than 0.5 centimeter or 1 centimeter depth on your face, definitely you can mention it as a grievous injury. But when the case will be coming after 2 or 3 years, so whenever you are appearing in the court, there may not be the scar visible, and they will be asking you, so how can you give us a grievous hurt since there is no permanent disfigurement on the face? So you can justify that. So if I have not sutured, the patient will be coming with a permanent disfigurement. So with the treatment, the scar has been minimal or disappeared. So like then you can justify that. So the same thing applies to the fracture of bone or teeth also. So you can give this as also example. So fracture is a grievous hurt, but after POP application or open rectal fixation, after some 2 years, if you take X-ray, you cannot find that fracture. So if it's some close reduction, so you can tell that. So with the treatment, the bone has now united. But at the time of injury, if I have not treated, this patient might be having some permanent disability will be there. Like that, we can justify. So all the things, whatever you are writing, whenever the lawyer is asking, we should be able to give some justification for your reports. Then this one is very important. The 8th point, it has 3 points, 3 parts. One is any hurt which endangers life. So this include extradural hemorrhage or patients with diffuse oxygenal injury, hemothorax, pneumothorax. So these things are not mentioned in the first 7 points. Okay, so any hurt which endangers patient life can be given as a grievous hurt. And second part is which causes the sufferer to be during the space of 20 days. This is very important. And sometimes the particular patient or the victim will be asking you to keep the patient for 20 days. Thereby, you can in the court they can argue that so the patient was hospitalized for 20 days and the punishment to the person who is assaulted, it should be more. So they will be, for that reason, they will be asking you to stay continue admission for 20 days. So don't do that. So if really the patient needs admission for 20 days, you have to admit. The patient does not need admission for further 3 to 5 days or something like that. The patient is improved, better discharge the patient. So don't prolong the admission. And third part is unable to follow his ordinary pursuits. So he's not, if the patient is having some assault with some knife, so he'll be guarding with his palm, or sometimes the patient will be having some heel pad injury. In that case, you will be applying after suturing or after the treatment, will be applying some POP, something like that. So these patients cannot pursue his personal activities. So something like eating or something, so day-to-day activities he cannot do. In that case, can give it as also as a grievous, though it cannot has some permanent disfigurement of the face or sight or vision. If the patient is not able to perform his activities for next 20 days, like a wound on the palm or wound on the sole, you can give it also as a grievous hurt. Okay, so this is an example of a wound certificate. So you have to write all the details as in the yearbook, and you have to mention what are the wounds present. In the yearbook, we will be seeing the only external wounds. In wound certificate, it will be at the end of treatment or discharge, at the time of discharge, we only will be giving wound certificate. So you will be giving all the CT reports with even ADH, SDH, pneumothorax, those things, all things should be mentioned in the wounds. And at the end, you have to give whether the wounds are simple or grievous. So if the wound is fitting into the above 8 criteria which I mentioned, so then you have to give it as a grievous injury. So other document needs a discharge summary. So in this discharge summary, do not mostly we are giving only a printed matter. So sometimes after printing everything, we will be seeing some mistakes in that. So don't overwrite it, don't strike it. Either get another fresh discharge summary without any corrections, or don't strike it. Okay. So if you are striking it, it's a manipulation. So there's a terminology called records and documentation. Record means you can change. Document means you cannot change. So for example, BP recordings. So BP recording you can change. You are written as 11070, and you are, again somebody has seen that it's only 9060. You can strike it off and you can change it 9060. So records can be changed. But same that BP record document, if it is a particular paper is given to the police or given to a particular patient attender, if it goes out of the hospital, then it becomes a document. So you cannot change it. So they will be taking some Xerox copy, something like that. They will be producing to the court. After that, you will be finding some mistake. You will be calling the patient attender and you will be asking for correction. They will be giving it to you. Then you cannot manipulate that. So in case if you want to manipulate, then you have to mention it as a discharge summary in bracket amended. Okay, so that's a safety thing you have to do. So don't manipulate the discharge summary once it is out of your hands. So you have to write the date of time, date of discharge, the patient died, then you have to write the date of death. Then any surgery performed, you have to write the date of surgery also. Multiple surgeries done, multiple dates also should be mentioned. Then diagnosis should be complete. It includes all the major injuries sustained, and it includes all the surgeries done. So all those things should be in the diagnosis. Then what is the course in the hospital? Then the discharge prescription with all the departments. Sometimes it's a polytrauma. So mostly single surgeon will be giving the prescription. So maybe a patient with ortho injury and also head injury. So you have to compile all the medicines what the patient should be taken should be in the discharge prescription. In the same in the discharge summary, it should be there. And you also mentioned the condition of the patient at the time of discharge. What is GCS? What is the motor power? The patient having quadriplegia, something like that. So what is the power in all the 4 limbs? So whether sensory deficits are present or not. So all those things, whether the patient is able to walk with support or without support. So everything should be mentioned. Then whether the patient fully recovered or partially recovered also mentioned. And you have to write all these, only these 4 words are accepted. Patient, 5 words, fully recovered or completely recovered, patient improved, but need not stay in the hospital, but he can continue the treatment in the home. And discharge against medical advice, or LAMA, leaving against medical advice, or the hospital is not having the particular specialty, you can refer the patient to higher center, or if the patient dies, you can give a death certificate. But never ever write the word called discharge at request. This is not acceptable by the court. So don't write the word discharge at request. Okay, you can write recovered, improved, DAMA, or refer to the higher center, or patient died. Okay, these are the 4 or 5 things you can write in the summary. Okay. So regarding the hospital bills, so only in the insurance cases they will be asking for it. So you have a knowledge about the bills. So sometimes the hospital will be mentioning as treatment charges, sometimes consultant charges, then surgery charges. So like that, multiple names they will be giving the bills. Okay, so you should know what is a treatment charge, what is a procedure charge, what is a consultation charge, and what is surgery charge. So in that, so you have to be able to explain to the court whenever you are asking to give evidence on behalf of your hospital management, or if you are an administrator. So you have to be thorough with the bills, whatever in the name of the bills patient was charged, you should be able to produce, you have to give the explanation. And you don't give another signature or writing which is not accepted in the bills. So only authorized person should be giving signature in the bills. And before going to the court, discuss with your finance manager or finance department regarding the bills when you are appearing for the hospital on behalf of or depositing your expert evidence. for MCOP cases, especially in insurance cases. Then coming to the case sheet, so always put the date, time, and signature with seal. So whoever has seen should be clearly known to the court. So sometimes the doctors will be putting a signature; they will not write their name underneath, and you will not able to find the thing when you are appearing on the court. So what time the doctor has seen and what date the doctor has seen. So sometimes it will be missing. So you should be very particular about that, and give at least twice daily notes for patients in ICU, and maintain daily progress notes if the patient is in ward, and if any procedures are delayed or not done, document the reason. So for example, the patient might be, you will be receiving in your hospital, the patient is a patient with acute MI, and you will be having an angiogram facility, but in the particular day angiogram, the cath lab machine will not be working. So in that case, you will be going for a thrombolysis, something like that. So in that case, you have to mention the reason for why you have chosen the thrombolysis. And even sometimes the patient will not be accepting thrombolysis. He will be telling you that I don't want to thrombolysis because it costs some 30,000 or 40,000 rupees. So directly tomorrow I will undergo angioplasty when the machine is getting repaired. So those things also should be getting documented, and it should be the continuity of care. So for example, the patient has suffered some breathing difficulty in the ward. So you have to write in the ward. So patient has having breathing difficulty at 5 o'clock in the evening. Hence, I'm shifting the patient to ICU. So in the ICU, they have to put the time as 5:15, and they have to write the patient received from first this particular ward, and the patient has some saturation is on 70%. So having some breathing difficulty. Hence, I'm starting with some oxygen support, or I'm intubating. Like that, if the patient is transferred from emergency to ward or ward to ICU, there should be continuity of care that should be depicted by your notes. Then try to document the lab values, scan reports, and say, by the side of your daily progress notes. And your action plans also should be there. So particularly the patient is having some hypokalemia or hyperkalemia. So what action you have done? And if the patient is having decreased urine output, so what is your observation? So for that, what you have done? So like that, if the patient is having hyperglycemia, what's the action you have done? So everything should be, the lab value should be on the, usually we write it on the left side, and the action plan will be on the, after your notes at the bottom. And the most important is consent. So always check the consent. So definitely, so we have a lot of errors. The nurses, if the consent is given to the nurses, so they used to write. So most of the hospitals, so they will make a lot of mistakes. So if you are the doctor, if you are going to do the procedure, and if you are the in charge, you have to check the consent. You have to read, and mostly if the handwritten consent is more than enough. Sometimes the printed consent is there, so you should not leave anything empty, any column empty or any space empty. All those things should be filled up, or should be given as a hyphen. So no space should be there in the patient's consent form. So in the court, you should not volunteer any witness if you are called as expert evidence. So you have to give the just what the question asks, you have to give that answer only. For example, usually I used to tell. So the lawyer will be asking the example. The question will be like this. So doctor, you are an idiot. Do you know that? So if I say yes, I know, then I am accepting I'm an idiot. And if I say no, so I am an idiot, but I am not aware of that. That's the meaning. So like that, the lawyers will be framing questions. So you cannot, only the yes or no answer will be given. Okay, you cannot give in detail, sir, I am not an idiot, I am an intelligence, I have studied for some 5 years, I have given getting some medals, and so many things. Those things you will not be given any opportunity to explain. So whenever you are going to the box, whatever the question is asked, you have to give the particular answer only. You cannot give any explanation. So volunteering witness is not at all accepted when you are going to the court as an expert evidence. But in negligence cases, you will be called as accused. If you are called as accused, you will be giving they will be giving all the rights to you. So you'll be having all the rights to explain your situation, your stand. So what situation you performed the surgery, or what given the treatment, everything, all the opportunities will be given to you. So only accused will be given all the opportunities, but expert evidence will not be given the opportunities to explain. So you have to answer the questions. That's all. You cannot give anything extra. Okay. So do not give evidence or accept without seeing the documents. That means, so long back I went for a MCOP case. That's a negligence insurance case. some 10 or 15 feet distance, the law is showing some documents to me. So there's a bunch of bills is there. So front page is given, bill is given by our hospital, and the last page also the bill was given by our hospital. In between, there was a bunch of bills. So from the distance, is showing that whether all these bills are given by your hospitals. So from a distance, if I am saying that yes, all the bills are from our hospital, then there will be document also the hospital has collected some lakhs. The patient may be taken treatment in your hospital for one admission. So he might be taken treatment in another hospital for multiple admissions. The total bill may be some 10 lakhs or 15 lakhs. Your hospital might have been charged only some 1 lakh, something like that. So he will be showing that 10 lakhs bill and showing to you these are the bills given by your hospitals. If you are accepting yes, it will be marked as your evidence. So just get the bill. So don't see from a distance. Ask the lawyer to give the bill to you. So check all the bills, even if it's a 20 or 30 bills, check that whether your hospital seal is there. Then finally accept it's your bill or not. Okay. So these type of things should be you should be very careful. Not only the bills, your AR copy, your own certificate, everything, or scanned reports, everything you have to take it in your hands, whether given by your hospital, verify it, then only you have to accept it. Then finally, so before going to the court, just to discuss with your police and if possible with the public prosecutor also. So they will be writing in the FIR that the police has come to you, they have inquired you, and you have given the evidence to the police that all these injuries are present. The police themselves will write all those things with your wound certificate and with your yearbook. So they will be writing the patient had an injury with some assault with so and so. So I encountered Dr. so and so. So the doctor has told that the patient has multiple injuries. So the first 3 injuries are simple, and the next all the other three injuries are grievous, something like that. The police will tell, but all those things will be written in the FIR, but it will not be informed to you. So before going to the court, just get the FIR, and you have to read thoroughly what the police has written in the FIR. And on the box, the magistrate will be asking you whether the police has informed you something like that. So if you have read the FIR and you can tell that to the magistrate that yes, the police has inquired me. Because if you tell that the police didn't inquire me, then the whole case will be shattered. So it will be like some fake case. The police has got money from the particular patient or a particular victim, and they have manipulated all the details, and they have produced in the court. So like that, the lawyers will be manipulating the cases. So, so we have to help the police also. So in that, for that reason only, before appearing on the box, so go to the court some 30 minutes or 1 hour earlier, or ask the police whenever the police is coming with the summon. So get the FIR copy. So you read the FIR copy. If FIR copy is okay for you, then you can accept that to the magistrate that yes, police inquired me. So what inquired? So you can tell that simply, I forget. So because the cases might be injury might have been taken place some 3 years back. The police, even they didn't inquire, to be on the safer side, what I will be saying is, so police has come to my hospital and the police has inquired me, but who inquired me, I don't know, I don't remember. These things are accepted. So you can tell yes, no, or I don't remember. So the patient, the police, lawyer is asking you, sir, at what time the patient got admitted, you can tell that at particular time can tell. So who admitted? There is no column, or who received you the summon, or who gave you the summon. If you don't have the details, you can simply say, I don't know, because I'm not having the document with me. So in future, I will correct it. So this type of words court will accept, even if you are going as a expert evidence. So be careful, but sometimes if you are not confident and you are not able to justify your stand, then you can have to tell that. So police didn't inquire me. So just today only the police is coming and giving me the FIR. So just I'm coming with my hospital document or my wound certificate or my yearbook. So I'm depositing the evidence based on that. The police never inquired me like that. You can tell that if you're not able to support the police. Okay. Then the first slide I have told you about authorization letter. If someone is addressed here, like this, some common names like chief medical officer, duty medical officer, casualty medical officer, or to the administration, or it can the doctor. Sometimes the doctor might have been resigned. So you may be another doctor, your colleague working with you. He might have been resigned, and someone may be coming with on behalf of the particular doctor. So you get an authorization letter from the hospital, then go. So otherwise, you can ask the police to get the summon in your name. So these are 2 things. So either get the authorization letter from the hospital and submit to the court, or ask the police to get the summon in your name. So these are the things. So don't go for a someone with a common name. But you should receive the summon. You cannot deny that there's no name at all. So you cannot deny that. You can receive it and you can give them feedback. So always remember the medical ethics and etiquettes. So have a knowledge about our Indian Medical Council or National Medical Council regulations. That's Act by 2002. So your professional conduct, medical ethics and etiquettes also you should know. Then breach of ethics are can amounts to malpractice and misconduct leading to penal erasers. They can suspend you or you can even debar from the medical board. So disability certificate commonly should not be given by emergency physician. So commonly given by a government doctor or a specialist. So, but you should know about sometimes the patient may be coming with asking about a disability certificate also. And this is a safe kit. Always have that. So that's a sexual assault care and forensic examination kit. So you should be always have it. So sometimes the patient may come with some rape, assault, something like that. So in that case, these are the things which should be readily available with this about checklist. So polythene bags to collect the patient's dress, something like that. Then swabs from the oral cavity, then from the genitals. Then urine container should be there for analysis for semen, something like that. Some patient's blood collection, syringes, combs from the pubic hair, you have to collect the samples, class lead, everything should be there. So this is available in our net also. So you can have that the safe examination kit. That's a sexual assault care and forensic examination kit. And always you have to check the nursing notes whenever you are called for negligence cases. Whenever you are sometimes the patient might have been died and the attendants may be accusing us as a negligence case. So your documentation and the nurse's documentation should be matching. So mostly the court gives more importance for the nursing notes rather than the doctor's notes. So because they are believing that the nurses will not tell lie. So doctors, because of that, having a lot of knowledge, they can manipulate something like that. So the nurses will not manipulate. So that's why the court is always comparing with the nurses' notes. So whenever we are appearing for negligence case, please check the nursing notes, which is correlating with the doctor's notes. This is a final slide. Whenever you are having a perfect document, so even I myself feel like a soldier with all the equipped weapons and everything, all the gadgets, all my personal protective equipment, something like that. And if your documents are not effective, you will be like a bare body, a particular person with a bare body, and you will be having a stumbling and you will be having some a lot of stress will be there. So documentation is very, very important whenever you are appearing for the cases. So always give importance for the documentation. So this I finish my talk. I once again thank Yashoda Hospital as well as SEMI for giving me this opportunity, and Organizing Secretary and team for the golden opportunity. Thank you.
Yeah, thank you, Dr. Sharvana, sir. Thank you so much. So it was an excellent and elaborate talk. Yeah. So three things I learned after listening to your class are like, so volunteering witness, then safe kit, especially safe kit. Then regarding discharge, how to write the discharge summary of MLC cases. You are mentioning certain things we should not write, like discharge at request, all those things. Then another one, section 320 IPC. Then admitting a patient for more than 20 days, especially those who don't require admission for more than 20 days. Then today really I came to know about all these things today. Thank you so much, sir, for enlightening on medical aspects of our emergency department. So there are few questions, sir. Can we take up those questions, sir?
Yeah, sure.
Yeah. So first question. So is consent mandatory for MLC?
No. So actually, there's a few rules are there, laws are there. One is IPC, another one is CRPC, another one is IEC. There is IPC means Indian Penal Code, so which describes the punishments. CRPC defines the crime. So which is crime and which is not crime is in the Criminal Penal Code. Another one is Indian Evidence Act, IEC. So that tells that it's a duty of the doctor to deposit the evidence whenever he is suspecting it's a MLC case. So for example, a patient may be coming with some multiple tablet poisoning. So you know that it is simple, some paracetamol 4 tablets, some 500 milligram tablets, 4 tablets, the patient may be coming with paracetamol poisoning. And you want to put MLC. So the patient will not be accepting. So I'm from some prestigious family, so don't put MLC. Otherwise, we will be going to another hospital like that, they will tell. So in 2011, Supreme Court has given the judgment that the suicidal attempt is not a crime. It's not a punishable crime. But our constitution tells that there are 6 rights in our constitution. So constitution it tells us right to live, so right to education, right to health, everything is there. But there is no word called right to die. So as per constitution, attempting suicide is a crime. But according to a Supreme Court judgment, it is not a crime. So whenever comparing with our constitution and the Supreme Court, constitution is the upper hand. Okay. So whatever you can do is you can write in the book. Even they are not at all giving the consent, but you need not intimate the police. You can keep the document with you. If the patient is surviving, so no problem. If the patient becomes sick and you have some gut feeling that this patient may die on course of dying, for example, patient with some red clot paste poison, something like that. So first 2 or 3 days, the patient may be all right. After that, the patient will be becoming sick. In that case, you can give it as a late intimation. Okay, so always make a air entry, even if the patient is not giving consent. So don't worry about it. You have to make a air entry. But intimation to the police, you can decide whether to intimate or not to intimate. You can decide as per the local situation which is available. So always do not wait for the consent. So definitely you have to make a air entry. You have to make it.
Exactly, sir. Then, so one more interesting question, sir. So when we are doing intubation, if teeth get damaged or lost, does it require to do MLC?
Repeat it. I couldn't follow.
No, when we are doing intubation.
Okay.
So if teeth get damaged or lost, does it require to do MLC? If we are not doing from outside, if attendants wanted us to do MLC in view of loss of teeth, so what we should do now?
Actually, this will not come as it's MLC. It will be going as a negligence. So, but you have to document it. The patient has while you're intubating, the teeth has come out or you have broken the teeth. So you can tell the attendants. So be open. So you document the case sheet also. So inform the so and so attendant. But teeth broken is not a major thing nowadays with a proper dentist. So partially broken teeth or avulsed teeth can be again reimplanted if it is within some few hours of within some 4 to 6 hours. Again, I can reimplant it. Okay. So maybe some extra charges will be there, so that you can have to document it and get the consent from the patient and again reimplant it. So nothing will happen. But if you hide after when the patient is becoming conscious and you are extubating, that time the patient may be telling that I'm not having teeth. So then it becomes a negligence. So medical legal cases, actually it's not a punishment for us. So all those cases you will be called as expert evidence. That's all. So you'll be given right to royal respect. So doctors should be treated with full respect when you are called as expert evidence. So, but lawyers will be a little bit, the questions will be some arrogance or some insulting questions will be there. Otherwise, you'll be given due respect by the court or judge. But if you are going for the court as accused for a negligence case, then only all the problems comes. They will be charging you 50 lakhs or they will be asking you 1 crore. So you cannot bear the torture. It will be, the case will be dragging for years together. So better you mention and get attendance consent, and again, if a dentist is available or if a dentist is not available, get the dentist opinion from outside and you can reimplant it.
Okay.
So it should be open. You don't hide it and don't put MLC for that.
Yeah. As per section 320 IPC, loss of teeth itself is a grievous injury.
Yeah.
Yeah, that is the more worrying thing about it, sir.
Yeah.
Then one more question, sir. So it is from one of the residents. If MLC is been documented by one of the ER residents, then who has to attend the court?
So what I am practicing is always I used to attend. So MLC that year, if my resident has returned, even his name will be there, and he will be writing as a MEM resident or a CCTM resident, something like that. But what I will tell to the police whenever I am receiving the summon, I will tell them that this doctor is not available with me now. So he has gone for long leave, or sometimes he has left the hospital, something like that. So better get the summon in my name. So they will tell, sir, no problem, sir, you can come. So in the court, I will produce a summon, or in that case, you can get some authorization letter from the hospital. So our hospital will give. So Dr. Saravanavel, the head of the Department of Emergency Medicine, will be appearing in the court on behalf of this particular doctor, since he is not available for appearing in the court on the particular day or time. So kindly permit him to attend the court. Like that, we will give a authorization letter from our management. So this thing can be done. But your emergency department head is not interested, then no problem, nothing. So the residents can go. So because the residents soon after finishing your MEM, you are going to become a head of the institute when you are going to work. So you can have some experience when you are going to the court. So what I feel is, since the residents are a little bit inexperienced, they may not be able to take some questions. So for that reason, I used to take all the cases for me, by me. So it's up to the particular hospital. So was written, it's as per law, the person who was written has to go to the court. But if your senior doctor is ready to go, so you can transfer the summon on the name of the senior doctor and they can appear in the court.
Yeah. Then one more question, sir. If you receive a patient with history of fall, but an examination turns out that the patient has been a victim of physical abuse, how to deal with this case as a medical legal perspective?
In that case, so actually we are not going on the spot. So whatever the patient is telling, we are writing. Okay, so for this reason, I usually write all the even accidental fall or hit by a cow or some dogs crossed, and even I applied brake and slip and fall. So the problem may be with the patient, but he may be something drowsy or some unconscious, or somebody might have manipulated. So some lawyers will be telling that, so you have to do like this, so you have to give the history like this. So I have not went to the spot. That's why I'm writing alleged history of.
Yeah, exactly.
Not writing history of a fall. So I am writing alleged history of falls. So somebody told me like this. So whatever may be reason, I better put a MLC. So sometimes I will give a scenario. So patient may be coming with a dog bite, maybe a stray dog. So if you say if it's a stray dog, so I cannot, they cannot go and claim any compensation. Still, they can claim to the compensate. They can sue the government. So the Pune municipality has not restrained this stray dog. That's why it has bidden me. So from the government, I give some compensation, some 50,000 or 1 lakh I have to give like that. They will be asking that. So for that reason, I'm putting MLC with the stray dog bite. But if it is a domestic dog which has bitten, even the particular patient, he can sue the owner of the dog. So the doctor has not restrained the dogs. That's why I got a bite. So I have suffered a mental suffering. I had some pain is there. I had for treatment purpose, I was spent so much of money. So from the owner, I get some 2 lakhs or 5 lakhs compensation like that. They can sue them. So even the road is it's not fair. The patient might be in the rainy season. They will be getting a fall. So some super intelligent people, they will be suing the government or municipality. So that's why we will be putting AR entry for a patient who's having self fall also.
Yeah, that's true. Then one last question, sir. Patient brought to here, initial examination shown to have some abrasions, kind of injuries. Then patient went on LAMA, found to have, admitted somewhere else, then found to have pneumothorax or hemoperitoneum. If we get summons, then how to protect ourselves?
So only your AR copy will be telling that. Another one is if it is a small hospital, it's justified. So what the code is telling, it is up to your skill and talent. So if your hospital is having some few beds, 5 beds or 10 beds, and you don't have any X-ray setup or CT setup in your hospital, so you can justify that. So my hospital is a primary care hospital or secondary care hospital. We don't have that particular setup in the evening time or after 5 o'clock time. We don't have that technician, so you can justify that. But if it's a multi-specialty hospital with the corporate setup, everything is there, so you cannot justify that. So in that case, what you can tell is, when I was examining, I could able to appreciate this thing only, and the patient stayed for only some few hours, and the patient didn't give me the time to examine or evaluate. So for that reason only, what we are telling is, so don't send the patient as a normal discharge. So send the patient as against medical advice. If you really think that the patient needs some observation or some close monitoring, so for some at least 6 or 12 hours, you can advise them to stay there in the hospital for some few hours. They're not willing, better send the patient against medical advice. That's called contributory negligence. So if you are missing, it's a gross negligence. If the patient is leading, you are not accepting your treatment or not obeying your orders or your suggestions, then it's called as a contributory negligence from the patient side. So again, it's a protective weapon when you are going to the court. Okay. So again, actually, if it's an MLC case, so nothing will happen since you are called as expert evidence. So the lawyers will not harm you much. But if it's a negligence case, definitely you will be in trouble.
Yes, sir. One more question, sir, from Dr. Sohashni. Should MLC be done if patient is transferred from private hospital to medical college hospital or from one hospital to another hospital?
Yeah, definitely. So because, for example, patient will be shifting from some government hospital to a private hospital since want of a better care. So they may be making some year entry. In that year entry, they may be documenting some wounds. But whenever you are receiving, you will be finding some other new wounds, some abrasions or something like that. So it may be sometimes during the transport, the patient might be sustain some injuries. For example, when you are shifting the patient stretcher, he might have fell down. So you'll be getting some contusion, some stretcher might have given some lacerations. So the metals will be giving some metal, on the floor, they fall down. So you'll be getting some laceration. It will be new wound. Okay. This wound will be appearing during the transport. So for that reason, again, you have to put again another MLC. So there will be sometimes comparing with the air copy from the two hospitals. In the primary hospitals, the wounds are some 3 or 4 wounds are there. But in your hospital, you have mentioned some 6 or 7 wounds. Either the doctor who received the patient in the primary hospital have missed that, or the patient might have sustained wounds during transport. So you always put a MLC whenever again you are receiving a case from a private hospital or government hospital, whatever it may be. And one more question I saw, some what's the duration? So there's no clear-cut guidelines from the government. So how long it should be MLC like that? So the patient is treated and discharged from hospital, you need not put MLC. So for example, the patient was admitted for some clavity fracture or pneumothorax in the government hospital, and he has discharged after 7 days. He left home, and again the next day he's coming to our hospital. So with some fever, something like that, you also found that some pyothorax, something like that. So in that case, you not put MLC because the patient has been treated for that particular wound. But the patient coming to you with a complication for that wound, for that you need not put MLC. The MLC which is made in the government hospital is more than enough. But the patient is coming to your hospital for the continuing care. So he might be having some head injury. He might be taking treatment for the head injury for a particular hospital in 1 month. After 1 month, the next day or next 1 hour, he is coming to your hospital. You continue that MLC. Even after 1 month, also you can make the. But you can write all the wounds are limited. You'll be seeing. You can see that some sutured wound or some healed abrasions. So those things you have to write. So don't mention as a fresh wounds, some abrasion on the forehead, something like that. It's a healed abrasion, something you can mention like that. Or some procedure might have done. You can write the. In the wound certificate, you may not mention it's a grievous wound. So they might have given some surgical scars. You can write the surgical scars in your yearbook, but don't give it as a grievous hurt when you are going to the court, when you are giving wound certificates.
Yes, sir. They should have mentioned the old MLC with the new one.
Yeah. So you can write it. The previous one will be giving the yearbook, year copy, the patient. So you can write that from the government medical hospital or medical college, something like that. So the patient came with the ER number, this one, copies of this one, and you can put a fresh entry on your. So you have to write the which hospital they have treated with the MLC number, or what are the documents they have come with. Those should be mentioned in the yearbook.
Yeah, thank you, Dr. Dr. Saravanavel sir. Thank you so much. So I thank Dr. Srinath sir, and Naveen sir, and Yashoda Hospitals, and our SEMI, of course, and NBI for creating such a great platform for creating awareness among all the things which is required for emergency patients and for the medical fraternity. Thank you once again.
Yeah, thank you.
Thank you, sir, for gracing the webinar platform. We have had a lot of questions. Thank you so much.
Yeah, thank you.